Okay, so that's the pelvis, and then from there we're going to reach into the upper thigh bone, and that's the femur. And that's the biggest bone we got in the body. The femur has a head. It has then underneath the head it has a narrower end. That's the neck, and then it's got a couple of bumps. It's got a bump on the outside, and it's got a small bump on the inside. This is a look from the front. And so the big bump on the outside is the greater trochanter, and the small bump on the inside is the lesser trochanter. It is really hard to feel the lesser trochanter. Plus, the muscles that go into the lesser trochanter are the ones that raise your thigh up, and so they get always very, very tight. They work very hard. But look, here's the greater trochanter. From the back, it's indicated here. There's a greater trochanter. And then the lesser trochanter is a little bit easier palpated from the back as well. And then as you go down in between, in the back, there is a lot of muscle attachment. So there's a lot of ridgy stuff back here. Because if you look at the quads, the muscles in the front of the thigh, they are actually attached to the back ridge of the femur. And so then they reach around. That's why they're really big. They're the biggest muscles. They're the most powerful muscles. But if you think about it, if they don't contract, you're not going to stand upright because they keep your knees straight. And so if you don't have them constantly contract, if you stand, you're going to the knee will bend and you fall down. And so they need to be very, very powerful. And so you also, in that section here, that's actually called the linea aspera here, in that roughened area, you also have the muscles attached that bring the thigh medial, that adduct the thigh. And so that's the other muscles attachment that we get there. So that's another massive amount of muscle. And then we have joint creating surfaces at the other end. And that's known as the medial condyle and the lateral condyle, those two. So one is on the outside, that's lateral. One's on the inside, that's medial. So that's from the back. If I look from the front, we also have a surface for the kneecap, and that's the patellar surface. The kneecap means patella. The patella. And there is actually pictures of the knee. So see, here's the patella. There's the condyles. Oh, and then what I didn't mention, these areas right here are the epicondyles. We have epicondyles on the femur, we have epicondyles on the tibia. And we have also condyles on the tibia. We did not get to the tibia yet. This bone here, the shin bone, is the tibia. And it has a similar named joint structure. So there has a condyle on the condyle on both the femur and the tibia, and then epicondyles on both the femur and the tibia, both the lateral and the medial. The interesting thing that you can see here, and some people might have had problems before, you see this round sort of bluish thing here, and then there's another one here. Those are cartilages that are really stiff, like Tupperware type plastic stiff. And they glide the joint, they guide it through the motion when actually the joint needs to bend, because it's actually not just rotating, it's kind of an interesting bending mechanism. But those are the menisci, and so often we have meniscus problems, or somebody has a meniscus surgery, because if some of this cartilage breaks off and goes and jams into the joint, then guess what? That's very painful, and so you want to get that out. And so that's what the meniscus is. Down here you can see a knee replacement. That's metal. Whoa, crazy stuff. All right, so that's the tibia right here, the shin bone, and the shin bone is right here. So medial condyle, lateral condyle, and then the epicondyles. But what we have here is also in the front, we have a bump. And that bump is known as the tibial tuberosity. That bump is where all those quad muscles, all those front thigh muscles, they all go and anchor into that after they pass, their tendon passes through the patella, the kneecap. And so when they contract, guess what? They bend, they straighten the knee out, they pull on that thing. And in teenage boys, particularly when they grow up, sometimes their muscle develops faster than their bone can be developed, and so the muscle pulls on the bone, and that's very painful. And if it's severe, that's known as Osgood-Schlatters disease. If it's not that severe, they call that tibial tendinitis. So then here, that's the shin. the tibia shin. And then, oh, we have one more thing. Look at that. We have the intercondylar eminence. That's actually ligament attachments. Right here on top of the plateau where we have the knee joint, we have this thing sticking up, and there's ligaments, bands that connect from that bone upward to the femur and anchor the femur and the tibia together. That's called the intercondylar eminence. And then as we go distally, at the end here, we basically have an inside bump on the ankle and an outside bump. And the medial, the inside bump, is called the medial malleolus, or malleolus, and that's part of the tibia. On the outside is the lateral malleolus, or malleolus, or whatever. Sorry about that. And that bone that belongs to is actually known as the fibula. And the fibula on the other end, on top, has a head. That's the other bump that I want you to learn. The fibula is interesting. The fibula is not really a weight-bearing bone. The weight pretty much comes up and down here through the tibia, right that way. But it sort of anchors it sideways and makes it not fall outward. And so it's definitely a very needed bone. And that brings us to the ankle and the foot. So when we go down there, we have multiple bones. So this is actually an easier picture to see here. Start with at least. We have the tibia come down, the fibula on the outside. So that's the inside, that's the outside. And then we have the tibia mainly going to one cube-shaped bone and attached to that. And that's known as the talus bone. And then if you look down here, you go towards the heel of the ankle, and the heel of the ankle is a big bone as well, and that's the calcaneus bone. And then as we move forward from those bones, it's kind of interesting because you kind of can take the first and the second and the third toe and part of the inside part, the medial part of the foot itself, and then the outside part, and they're kind of like two different ones. And so the bone on the outside, two bones coming forward to the small little toes, the two small toes, is known as the cuboid. And the ones that form then the first three toes are known as the cuneiforms, and there's three of them. And from there we get into the web of the foot, and that's 5 metatarsals. In the wrist there were metacarpals, and here there are metatarsals. And from there we go into the phalanges, and it's like in a hand. We got 2 for the big toe, the hallux, a proximal and a distal. And we got 3 for everybody else, a proximal, a middle, and a distal. And these are just some other pictures that show us the calcaneus, the heel bone in the back, the talus, and where the weight comes down from the tibia. And actually the weight goes actually to the back into the heel and to the front into the forefoot. And then, of course, when we get to talk about the foot, we have to briefly mention when we twist the foot, because who has not twisted a foot? Many of us twist foot. And so when we twist the foot, it usually goes like this, an inversion sprain, pang. And we have an issue with the ligaments on the outside that hold all that together. The ligaments on the inside are very, very strong, so they don't break. There is a tendency to go this way. And when that happens, well, for once, of course, it hurts in here, especially if the bones are not in the right place anymore. We have to sort of move them around a little bit, or at least that's helpful if you do that. But then the other thing is there's a muscle that comes from the outside and reaches underneath the foot and attaches underneath right there. And so that muscle then will help pull that foot upward. And in physical therapy, in rehab, that's why we're doing things like walk on the beach or do wobble board things, but move the ankle around, that we have to sort of retrain the neurology in the ankle to feed back into the system and be able to have a normalized motion that is supported by muscle. So that's an ouchie. But the other thing that is interesting in the foot, we have these arches. We have in the inside the medial longitudinal arch that goes from front to back. But then we also have an arch that goes from side to side. And so the arches create like a spring-like construction that when the weight comes down, it spreads out and it springs out a little bit, and it doesn't just bang onto these bones. However, if we have a flat arch, it can be bad, not absorbing so much shock, and that can be painful to walk. So, we have to be understanding of our feet if they hurt at times, and we have flat feet. So this is like a neutral arch, high arch, and a flat arch. There's also what's indicated here, the green thing, that's a ligament that goes on the bottom. That's the plantar aponeurosis or plantar fascia. And often people get plantar fasciitis, and that's an inflammation of that ligament. Okay, well, that was good paying attention. Good job. And I hope you learned something.